Well, hello friends, hello fellow distributors. I welcome you to today is 6th of May. I want to welcome you to today's Health Fellowship Hour. My name is Patrick, a 5-star distributor. Today's topic is pancreas and diabetes. I'm going to bring to you this topic that closely relates to pancreas. That is an organ in our bodies, a very vital organ, and it is closely related to a lifestyle disease that we call diabetes. So welcome friends, let's get together. Now, diabetes. Diabetes actually is a global phenomenon, a global pandemic that affects people across the globe throughout the world. It's a global pandemic. It is prevalent all over the world. It's a wide occurrence. That is diabetics. It's not localized to one region of the globe. It's all over. The pancreas too. Pancreas has very vital functions in our body. For example, it produces the pancreatic juice that helps in digestion. Pancreatic juice has so many enzymes that helps in the digestion in the stomach. In addition, it also secretes insulin hormone. The pancreas secretes the insulin hormone, and that is the key of our discussion today. The insulin hormones is the one that helps to regulate the metabolism of sugar in our body. When we talk of sugars in our body, we are talking of glucose, we are talking of starch that has been broken down to glucose, and then it's going to be utilized by the body. So in short, our topic is pancreas and diabetes. They are closely related. Pancreas releases insulin in our bodies, and insulin regulates the metabolism of sugars in our body. Now, once there is a malfunction of the pancreas, definitely now we have the complication of diabetes in our body. So if we look at our monitor there, we can see this vital organ that we are calling the pancreas with all the details there. We have other associated smaller parts. For example, there is the gallbladder. We have also the bile duct. We have the duodenum and the surrounding organs. I wouldn't want to go to that. Now, global wise, it has been found that around the year 2015, about 9.1%, if you do the calculation, 2015, one adult in every 11 adult had diabetes. That is, if you do the calculation, that's about 9.1%, 2015. In the year 2040, it is estimated that one adult out of every 10, that is about 10%, will be having diabetes. So you can see that this phenomenon or this complication of diabetes is quite widespread, and it is so significant. A percentage of 10% in the global population is quite big and quite large, and therefore it cannot be taken for granted. So join me as we move to the next part. I would want us to look at the signs and symptoms of diabetes. What will tell an individual that you have diabetes? What are the signs and the symptoms? Number one, they are quite simple. One, that person will always be feeling tired. You feel tired. You're not probably getting enough sleep. Maybe you have some stress, you have some depression, you're not doing any physical work, you are feeling very tired. That is one sign of diabetes. Number two, there is frequent urination. Frequent urination, for example, you want to go to the washrooms very frequently. You have the strong urge to pass urine. This might disrupt your sleep during the night, or it can disrupt your activities in the course of the day. because you have to visit the washrooms. Number 3, there is a sudden weight loss. Now, there are so many reasons that can make somebody lose weight loss, but when we have sudden weight loss, which is unintentional, you have not aimed at reducing your weight yet, there is a sudden unintentional weight loss, that could be an underlying chronic medical condition, and it's likely to be insulin. Number 4, we have a wound. You could be having a wound, say, in your limbs, and the wound is not healing. If you have a wound that is not healing, it may be in your forelimbs or maybe the legs, that is an indication of maybe complications of diabetes. Number 5 are the issues of the father and the mother at home, the issue of sexual relation. If that area has a problem, again, you should suspect that it could be an issue of an issue of diabetes. Number 5, yes, we expect that you usually take breakfast, lunch, and supper. But even when you have taken breakfast, before lunch, you feel that you are feeling hungry. You are hungry, always feeling hungry, yet you took lunch, you took breakfast. That is an indication that you could be having diabetes. Number 7, yeah, our eyesight. You use our eyesight to see. You'd expect that you see things very, very clearly and you are able to focus. Now, when you have a blurry vision, things are out of focus, things are not clear, that it could be an indication of complications of diabetes. Number 8, our feet, our toes, maybe our hands, when they become numb, the nub, maybe you are not able to sense, you're not able to move your fingers properly. When they are numb, that's an indication of diabetes that could be coming in. When you are always feeling thirsty, you need to drink water frequently in the course of the day, yet you have not done any manual work, that is a complication again of diabetes. And for the ladies, if you're in private parts and you feel that you have infections that are occurring frequently, that could be also an indication of diabetes. So very quickly, when you always feel tired, when you have frequent urination, sudden loss of weight, wounds that don't heal, sexual problems, when you're always hungry, blurry vision, numbness, thirst, and infection in the private area, for the ladies, that could be an indication that you have diabetes. Now, before I go too far, our mother company, Greenworld, has come up with this bottle here with what we call the glycoblock capsule. The glycoblock capsule helps us to manage the complications of diabetes. So our discussion today is pancreas and diabetes, and to manage that, I want to bring to you the glycoblock capsule. In a moment, we are going to go to the details of this. We find how we can manage diabetes. Now, there are 2 types of diabetes. Just briefly, there is what we call type 1 diabetes and type 2 diabetes. What is type 1 diabetes? Type 1 diabetes is a situation where the body immune system attacks the cells or the tissues of the pancreas. So the pancreas cannot be able to release insulin. That is type 1. Type 2 is where the cells of the pancreas, they manufacture insulin but very small quantity. Hence, the body becomes resistant to diabetes. To that insulin. No wonder now you have diabetes. So we have type 1 and type 2 diabetes. Now let's look at type 1 type of diabetes. Type 1 type of diabetes, the body immune system attacks the healthy cells, it weakens the body. This can be life threatening. That is type 1. Let's look at the risk factors of diabetes. What are the risk factors? Those people with the following types of lifestyles are likely to have the complications of diabetes. Those people with high blood pressure, you are predisposed to having diabetes. Those people who have a lifestyle of smoking, very, very dangerous. People who are very, very passive, maybe you are just seated at home watching TV, Maybe in the office, you are there just there with your computer. You are not very active. That is sedentary lifestyle. You are not very mobile. People who have overweight, excessive weight, people who have high fats and cholesterol in their body, all of them are at a risk. So we call them the risk factors. What are the complications that can follow once you have diabetes? Some of them we have already mentioned. One of them, you might not be able to focus properly. You have vision loss. It's unclear. You can't focus. You may have cardiovascular complication, coronary artery diseases, high blood pressure, cardiac arrest, stroke, and all that. Cardiovascular heart complications. You can have kidney damage, that is kidney diseases, or you may also have nerve damage, which may follow something we call amputation once you have the nerve damage. So all of them are complications of diabetes. We hope that we don't go there. If you'd arm yourself with the glycoblock capsule so that you manage any complications of diabetes. Now, what are the complications? We have already talked about, okay, maybe I can summarize the complications of diabetes. Once you have diabetes, there could be 4 or 5 cases or complications. One of them is that you can have kidney failure. Kidney failure, that means that now you have to go for blood transfusion and all that, cleansing of the blood. Kidney failure. You could have amputation of your leg if you have maybe a wound there that's not healing, maybe numbness, know that. You could have amputation. You could also have blindness because the eyes are not able to focus. And worst of all, you could have stroke. You could also have heart attack as a complication of diabetes. Now, what advice do we give to people who have diabetes, especially type 2? Type 2. One of the advice that we give to people is that they should regularly monitor or lower their blood pressure. Monitor your blood pressure, regulate your blood pressure and cholesterol in the blood. That's number 1. Number 2, we advise people to have maybe a walk. Let us be active. Maybe every 30 minutes in a day, take a walk. Just be active. Don't be seated there. Number 3, make sure that you manage your weight. We have already said that one. Make sure that your BMI is within the acceptable range. We also advise people to quit smoking. The lifestyle of cigarette here and there, quit that. It's very, very dangerous. And most important of all, eat healthy diet. A diet that has less fats, it has more fiber, it has whole grains, vegetables, fruits, and lean meat. Don't go for foods that have a lot of fats in them. When you visit any medical checkup, they are also going to test your blood sugar levels and all that. There's what we call the normal blood sugar levels. It could be there in the screen. There's what we call the fast blood glucose. That means that when you have eaten nothing and then you test the amount of sugars that are in blood, they should be about 100 milligrams per deciliter of blood. But once you have diabetes, that can rise to as high as 200 milligrams of sugar per deciliter of blood. Now, as I finish, I would want now to talk about management of diabetes, and this is the magic capsule from Greenwald, Glycoblock capsule. Greenwald products that boost pancreas function. Let's talk about that one. The Glycoblock that we have in this bottle here. How does it help us? Now, the capsules or the tabs that we get from here, they are going to help us to regulate the microcirculation and metabolism in the pancreas. They are going to reduce blood sugar and help pancreas to secrete insulin. The Glycoblock capsule, they are going to help in the microcirculation metabolism of the pancreas. They are going to reduce the blood and improve the functions of the pancreas. Very, very important. So we would recommend that if you are to equip yourself with this as a lifestyle, you will guard yourself against the dangers of having diabetes. So, friends, distributors, and colleagues, that complications of the pancreas and diabetes, we have already said, is a sensitive part. It is affect 10% of the world population, quite high. Me and you should not go that route. Let's arm yourself with these capsules. Let us make it a lifestyle. So as I finish, we are saying that the versatile team down here in Naivasha, you can visit us, you can give us a call, you can come for consultation, you can come and encourage us. Just give us our call. Our contact is 0701 158 821. Can I say that again? 0701 158 821. You can give us a call, you can encourage us. You can also follow us in Facebook. We are the Versatile Team, Naivasha Versatile Team. Just type there Versatile Team. You will be able to follow us. And of course, we are there in the YouTube. We advise or we recommend that you subscribe, follow us, and like us. YouTube, the Versatile Team. You will be able to follow our presentation in Facebook and in YouTube. So, friends, thank you so much for following up my discussion today. And as I finish, our magic bottle here, the glycoblock capsule to control diabetes, so that we don't go that route of diabetes in our life. So enjoy your life, pay us a visit, come for discussion. Thank you so much, and God bless you.